I prepared many teeth today with this air abrasion system. The nice thing about using air abrasion is we had many patients that came in today with multiple quadrants of areas of decay or old restorations we wanted to remove. And many of my patients will come into the office, we'll do the work, and they go back to work. And if I can do that without having to numb them up, that's something that they do appreciate. So here's a patient that we saw, and he had some occlusal pits. And you look at that little dark brown occlusal decay on that most distal molar. That one actually went down into the dentin and then began to spread out laterally. And you look at that buccal pit amalgam, and you see that that's there. It's starting to get old and it's unsightly. So the patient wanted to have that removed. We gave the patient the option. We could numb the patient up. We could use our traditional drill those areas out and then fill it up, or we could use our air abrasion and not numb them up. So this patient chose not to be numbed up, and we just used the air abrasion. We were able to treat this quadrant and the opposing side on the lower arch. So when the patient left, they were thrilled because they didn't have to have any anesthetic. The thing that I really like about the air abrasion is I'm able to get into those little pits and grooves and very precisely remove any decay or the weak areas of the tooth and leave much more tooth than if I had used a burr. So some of you would think, well, air abrasion, doesn't that get messy because you have powder flying all over? The nice thing about this unit, the PrepStart H2O, is that there's a column of water that surrounds the powder. So basically you have a little bit of slurry that you'll see, but you don't have powder going all over your operatory. So in this case, we started out with these teeth, got in there, prepped it out with the PrepStart H2O, and you can see that there's a slurry of powder all over, but you can see the prep, especially in that tooth, not the distal one, but the one mesial to that, how we've actually removed the amalgam without numbing the patient up, and you can see we're actually into the dentin. So it's nice that we have the ability to do that without any anesthesia. We then restored the tooth, and the patient was able to leave, go back to work without any numbness at all.